Come in.
Hello, Mr. Renhel. My name is Jacob. I'm a registered nurse. We're going to be doing an abdominal assessment on you today. We're going to be listening to your abdomen. I'm going to visualize your abdomen, and there will be a little bit of pressing on the abdomen here. First off, we're going to go ahead and get some relevant history on your abdominal area. First, I'm going to ask you a few questions. How are your bowel movements?
Regular, I have one a day or so. Any constipation or diarrhea?
So no constipation or diarrhea?
No.
Okay. Have you had any recent changes in your bowel habits?
No.
Okay. Do you ever have any abdominal pain?
No.
How would you describe your appetite?
Very good.
Okay. Have you had any recent weight loss or weight changes?
No.
No. Okay. Any history of abdominal surgeries?
No.
Okay. Do you currently take any over-the-counter medication, prescription?
No.
Or over-the-counter? No?
No.
Do you take any supplements or vitamins?
No.
Okay. All right, Mr. Junior. First, we'll be assessing your abdomen today, which may be discomforting on your bladder when I'm pushing that area. Do you need to use the restroom right now? Maybe to empty your bladder?
No.
You're fine. Okay, sir. All right, sir. Can you please stand for me and remove your shirt? Place this way for me. All right. First, we're going to assess the contour. First, we're going to be inspecting it from side to side here to look for symmetry from front to back. So side to side, we're looking symmetry. You know, is the hair evenly growing on each side? Is the umbilicus midline? And we're also going to be checking this later. We're also noting if there's any protrusions, any masses, or any indentations as well. And like I said, we're checking this both standing and later on when he's laying down. We're going to go ahead and get measure the circumference of the abdomen. With the line at the umbilicus, we were at 117. So we're just going to go ahead and write down the 117. Okay. All right. And then also while you're looking at the abdomen here, you want to be able to identify if there is any diastasis of the abdominal rectal muscles here. Would be a separation. Obviously right here we can't notice visually, but later on we'll inspect by palpating that area. We're looking also through the whole body, see if we notice any jaundice, which may be an indication of liver problems. You'll notice that the skin is intact, any lesions, which we don't see any here on the abdomen area. As you can see, the hair is symmetrical and black here. No surgical scars. No linea alba here from the ornagra, extending from the umbilicus and down. We don't see any striae, which would be your stretch marks. No interrigo noted under any of the folds here, any abdominal folds. So no rashes or anything like that noted. The color is the same of all the surrounding skin, upper and lower. The umbilicus, like I said, we noticed is a midline. It's intact. Color inside is the same as all around. No foreign bodies, no piercings. There's no visible peristalsis of the abdomen. No visible pulsations. His respirations are noted as diaphragmic. So now we're going to have the patient lie down. If you can please lay down here in the bedside. Okay, so now we have him lying down here. And again, we're noticing the contour of the abdomen while he's lying now in this position. We're noticing the symmetry, noticing if there's any protrusions, any indentations or masses. So we don't notice any right now on Mr. JR. Okay, now we're also going to auscultate. Okay, and before we come in here to auscultate, we're going to go ahead and warm up the diaphragm here, just so we let them know it's not going to be cold. You're going to listen to all four quadrants, so we're breaking up the abdomen into four quadrants, which is your left upper quadrant, your left lower quadrant, your right upper quadrant, and right lower quadrant. Okay, and we're going to listen to bowel sounds with the diaphragm. Okay, and we're just listening for the presence. Should normally be 3 to 35 a minute in each quadrant. If you don't hear any in the quadrants, you can listen to each quadrant for 1 to 2 minutes, or you can listen for 5 minutes here in the right lower quadrant. Okay. Also, we're going to listen to the abdominal aorta. It'll be located here in the epigastric area. Seeing if we can hear any hums or thrills or bruits. Thrills we would feel for later on when we palpate. Okay. Let's listen to it with the bell, because it'd be more of a high pitched sound. And we're also going to listen to the renal arteries, which can be here on the side. And there'll be 2. And they'll be located in the central ventricular line here on both sides. And the arlistic arteries times 2, which is going to be slightly here below the umbilicus, on either side of the umbilicus. And last, we're going to listen for the femoral arteries here in the inguinal area. Okay, and get deep down in there. If the patient have a gown, of course, you only want to expose the areas that you want to listen to. Okay, next we're going to move on to listening to friction rubs. Okay, so on the friction rubs, it's best heard with the diaphragm. So I'm going to go back with the diaphragm. Okay, we're going to listen to the hepatic, listen for a hepatic friction rub, which is best heard in the right upper quadrant. Okay, which we do not hear. A splenic, which is we heard in the left upper quadrant. And then a peritoneal, which we heard here on the abdominal surfaces. Okay, which none are present this time. Next, we're going to move on to percussion. We're going to percuss in all 4 areas, all 4 quads, which we should hear tympany, which is expected, and maybe a dullness over here in the liver, depending on where that's at, but we'll get into that in a moment. Or if the bladder was full, we can hear a dullness down here in the lower area too. So we're going to use index finger, the dominant hand. Okay, we have a good tympany sound throughout. We're going to check the liver span now as well. So the liver should span anywhere from 4 to 8 centimeters from the mid-sternal line, 6 to 12 centimeters from the right mid-clavicular line. So you're going to come straight down here. We're going to start here, and we're going to percuss here at the umbilicus. We're going to work our way up. So we start to hear that dull sound. And then there we'll slowly start to move up in the intercostal spaces. Okay, until we don't hear that dullness anymore. Okay. Also, in order to feel the liver as well, you can have the patient. You're gonna feel here underneath the ribs here. You're gonna have the patient. Can you please take a deep breath, sir? And you're gonna grab onto that rib. Okay, and then go ahead and exhale. Okay, and you should feel the edge of that liver, which would be a firm, sharp, regular, smooth edges on there. Okay, next we're going to go into palpation. We're going to ask the patient if he, like I said, make sure the patient needs to avoid, so this can be discomforting if they have a full bladder. Okay, we're just going to slowly palpate onto the abdomen. It's a light palpation. First, we're feeling for diastasis of the rectal muscles, which you'll feel here in the middle, right below the epigastric area. You can feel those muscles if they're sort of just moved into the side. It'll be real soft there in the middle. We're feeling for any some thrills since we're doing light nodes, spasms, noting any pain. Do you have any discomfort there, sir, while I'm pressing? No. Okay. And remember, if there was any pain while we were percussing, of course we wouldn't palpate. Okay. Next, we're gonna we're gonna attempt to see if patient's positive for Murphy's sign, which could be a sign of acute cholecystitis. So what you're gonna do is you're gonna with your hand you're gonna press in here, just in below the costal margin, and you're gonna ask the patient to take a breath test. Mr. JR, please take a deep breath. Okay, and if it was positive, the patient would experience pain and would stop short from inspiring. They would stop taking that deep breath because they would feel the pain from there. So in this case, it was a negative Murphy sign. Okay, now we're going to do deep palpation. We're feeling for organs, masses, noting any pain to any of the areas. So we're going to do some deep palpation. Just let me know if that hurts, Mr. JR. Okay. All right, and we're also going to notice here the spleen. We're going to be trying to feel for that spleen. Patient might sense, left upper quadrant fullness. They might be complaining about when they get here. You would only usually be able to feel it or see it if it was 3 to 4 times enlarged, more than its normal size. Okay, you can percuss over the 10th rib. You should hear dull. So you're going to start off here at the bottom. The first is the 12th intercostal space, 11th, and then 10th. So you should hear that dull sound. You can also do this while the patient's standing as well. While you're percussing that intercostal space. On the kidneys, okay, you're going to palpate each kidney. It's going to take some deep palpation separately. It's going to be between the rib cage here and the iliac crest right here. So you're going to fill in there deep. Okay, and this right side is more likely to be felt here. You're trying to capture each one as you're pressing in there. Okay. Okay, you're gonna extend towards the midline here, and like I said, you're trying to feel for that kidney. All right. You're gonna have the client inspire deeply. Okay, take a deep breath. All right, and you want to feel right there, and then just slowly release your hands. Okay. Now as we continue on, like I said, as they're doing that, you're making them take in deep breaths. You're going to determine the size, shape of the kidneys. Notice any discomfort when you're pressing on the kidney areas. And you would be better off on the other side to try to capture that one, but for this bed, we'll just do here on the left hand or the right hand side. All right. And then also later on we'll palpate and percuss for tenderness here in the backside right now when we get there. Now checking for any kind of appendicitis. They complain of right lower quadrant pain and discomfort. They might even feel rectal pain. You'll notice facial grimacing. Whenever he was walking into the office, you might notice a shuffle. Marchial sign, which is a heel drop and a heel jar. Involuntary guarding, just pretty much grabbing the area. Next, we'll check for peritonitis. We're going to do first, which is McBurney's point, which we're going to come here from the umbilicus. We're going to come down here to the iliac crest over here, halfway, 2/3 of the way there. You're going to press in. Okay, they should feel some discomfort in this area. Also, while you're pressing in, you can let go. And if they felt pain upon the rebound, that would be a Bloomberg sign, which would be more discomforting upon the release. You have Robinzik sign, which would be pain elicited to the right lower quadrant, the right lower quadrant whenever you're palpating the left lower quadrant, and the patient would feel the sensation of pain over here. You have ileosis sign, which you can have the patient flex his hips and knees. Okay, can you just push against my arm? Okay, you do that on both sides. And they're gonna flex that against resistance, and they would feel a sharp abdominal pain. So it was negative here. Can I please have you turn on your side? Okay, and then you're gonna have them try to externally rotate that hip. Okay, just sit back up. And you have the arbitrator sign. You're gonna have them flex their knee and their hip. So flex your knee and your hip, and you're gonna try to externally and internally rotate both. See your next one. Okay. All right. So there was no pain there with that. Okay, sir. Can you please stand up? And last, we're gonna check for the costovertebral angle pain. So we're gonna do one side at a time. We're gonna go back here, and this will be an indirect. Okay, and then there would be a direct. Was there any pain or discomfort, Mr. Redhead?
No.
Okay, sir. You can go ahead and get your shirt back on.